Using its patented technology dCELL, Tissue Regenix develops and manufactures products to regenerate healthy tissue for patients to address critical clinical needs such as wound care, heart valve replacement and knee repair.
Regenerative medicine is an area of intense focus at the moment. Kids today, they're going to live to be 100 years old, and quite clearly your body's not designed to last that long. So we're involved in constructing a new paradigm-shifting range of medical devices that will move away from the traditional metal and plastics of the past to regenerative devices, i.e. things that regenerate naturally within the human body as they're deployed. We've adopted a parallel strategy of launching products using various types of tissue, but our competitors really are adapting old-style technologies.
The business was a spin-out from University of Leeds research, which would bring solutions like ligament repairs to a rapidly growing sector.
The original aims of the research were to develop a process for removing the cells from cardiac valves in order to produce acellular cardiac valves, specifically for use in young children who needed heart valve replacements. The dCELL process works literally by washing out the cells from a tissue, just leaving the structure of the tissue that we call the extracellular matrix intact. And when this extracellular matrix is implanted into a patient, then the extracellular matrix is repopulated with the patient's own cells, so that over time it becomes part of their own body.
More than 500 children below 12 years of age have benefited from dCELL homograft in cardiac surgery to date.
I think the importance of the business-academia interaction is incredibly useful, because we provide them with a perspective on how this product might be deployed in real-life clinical situations. And that helps craft what they do in a very, very unique way. When I first joined the company, it was 2 scientists, me and a lab. So we're now over 70 people, and we're deployed in the United States and in Europe. We've taken the resources we have, we've managed them wisely, and that has meant we've attracted good, strong investors into the company, which has enabled us to deploy more things more rapidly than we otherwise would have done.
Tissue Regenix is developing multiple uses for dCELL using both human and animal donor tissues. The company's first commercialized product, DermaPure, is used to heal wounds with one application, a potential benefit for cost-conscious healthcare providers and private patients. It was made available in 31 US states within 6 months of receiving reimbursement under the country's Medicare scheme.
This allows clinics to utilize the product and be reimbursed for the product by the federal government. Commercially, we're well ahead of our schedule at this point in time, where we anticipated being. DermaPure has done exceptionally well, and that bears a significant amount of weight over randomized control trials. So the efficacy and the clinical outcomes that we're achieving with the product bear more weight than published studies.
The firm points to the testimonies of patients like Rachel Sheets. She's had to spend time away from her husband over 4 years in a nursing home with ailments such as a chronic pressure sore. She managed to go home for a couple of hours on their 57th wedding anniversary after her wound healed.
The first time they took the bandage off, they said it was already starting to change, and it just gradually kept closing in and just healing. I feel a lot better after the skin graft, and I had hope for the first time of getting it healed maybe and getting to go home before too long, and that made me feel good.
With around 1.5 million meniscal or knee cartilage procedures carried out in the UK and USA in 2014, Tissue Regenix believes dCELL technology could make a real difference to the treatment of sports injuries.
I think this treatment has got a pivotal role to play in the management of meniscal injuries. If we can get if the dCELL meniscus is proven to be safe, to relieve the patients of pain, and ultimately to improve their function and prevent the treatment of osteoarthritis, it will be a complete change around in how we manage these injuries and definitely paved the way for xenograft implants into the knee.
We have a great technology base within dCELL. We have a strong platform. As you tell the story to investors, it's not a complicated thing to understand. They all recognise the things I'm talking about. So it doesn't take a massive amount of technical knowledge to understand what we're driving at, i.e. Recellularization, providing regenerative medical device implants that basically address a lot of the problems that people see in their everyday lives.